Hello and welcome to another video. So in this video, I want to talk to you about monkeypox. Yes, that virus that's all over the news. So why is monkeypox so important? So monkeypox is a virus that is normally known to infect rodents. In Africa, there are many outbreaks that happen in monkeys and also in humans. Typically, this is a virus that only infects rodents, but from animal bites, scratches, things like that, it goes over to monkeys or humans. And once in those species, they can spread, not commonly, but can spread between those species. So from one human to another human. So the risk to the general population remains low at this point, given that there's only 100 cases or a little over 100 cases around the world. But that does not mean that it cannot snowball, as we've known from a recent pandemic with COVID-19. But monkeypox isn't necessarily spread the same way. It's not necessarily as virulent as COVID-19. And the mortality rate is really not the same as with COVID-19. So the concern overall is low, but it is still good to know about what this virus is, how to protect yourself from this, and how to protect your loved ones from this. So let's talk about why it is so important now. So typically there's only a very few cases, localized cases of monkeypox. It is very rare for it to be found in many different countries at the same time. For example, back in May 2003, there was an outbreak in the United States that was sourced back to pet prairie dogs. That's correct. These pet prairie dogs were stored in a storage facility in, I believe, Illinois. These prairie dogs appeared to have acquired the virus from African rodents that were stored in the same storage facility at a distribution center in Illinois. Once people took these prairie dogs home as a pet, they would either get scratched or bit by these dogs, or prairie dogs, and which are rodents, by the way, and get the virus. At that point, person-to-person transmission was not considered very likely, and there were no solid confirmations that it was spread person to person. So from May 15th to June 2003, there were about 71 confirmed cases of human monkeypox in 6 states in the United States. 35 cases were lab confirmed, and the others were essentially just presumed because they had pox, big pustules over their skin, and they probably had contact with other monkeypox cases, and so they were just presumed because it is expensive to do laboratory confirmation. So these people had a febrile illness, so they had fever, and then they started having a pustular rash, which means you have these bigger bumps, almost dome-like bumps that are covered, covering your body, filled with pus, so white fluid rather than clear fluid. So you have pustular rash, and they had at that point contact with these prairie dogs, and so it was very specific as to who had these cases, and they knew why. But now in 2022, there have been cases in the United Kingdom, multiple other cases in other European nations, and now in the United States and Canada as well, of people having monkeypox who have not really been known to have contact with other patients with monkeypox, or have been to African nations who are having current monkeypox epidemics. So let's talk about the current cases. In May 2022, a case was identified in Massachusetts. Now this person had traveled to Canada by private transportation, so in a car, and had not traveled to Africa. So we are assuming that somehow they either had contact with an animal with monkeypox or another human with monkeypox while they were in Canada. Or it was local transmission, right? Just because they traveled to Canada does not mean they acquired it there. It could have been here, because the incubation period is quite long. It's not like COVID-19 where, in 2 to 3 days you may start noticing symptoms. The incubation period for the pox virus, monkeypox, smallpox, it's longer. So for monkeypox, it's known to be about 12 days on average. Now, this viral strain is different than prior because there is more known human to human transmission, so the incubation period is also up in air. We will know once we have more cases and once we can corroborate the stories, we can estimate what the incubation period is. But in the past, it's been known to be about 10 to 14 days. So in that amount of time, people may have traveled to many different places, and it's hard to estimate where exactly they got it. All right, let's talk about the clusters in Europe. May 2022 is when it started, and currently it is still May. So multiple clusters of monkeypox in Europe exist currently, including Spain, Portugal, United Kingdom. So most cases were identified in men who have sex with men. So you can imagine, during most sexual activity, there is exchange of bodily fluids, which is how this monkeypox virus is known to be transmitted. Large respiratory droplets, so prolonged kissing, just not just traditional sexual acts, even just prolonged kissing can also transmit this virus. So at this time, we do not know the direct connections between these different cases and all over the world that are happening. But one hypothesis is that certain communities, that are having close contact with each other and then traveling out, may have spread it. But that's just all conjecture. So the first case was confirmed on May 7th in the UK. That person had in fact traveled to Nigeria recently. And then a week later, there were 6 additional cases. But these people did not have any contact with the initial case. So then question remains, did the guy who traveled to Nigeria get it from Nigeria? More likely, because he was in Nigeria. But these other people had no travel, no contact with the guy who already had it. So then you have to wonder, where did these cases come from? Could it be that it was all community spread from, say, a pet, or say some local rodents that may have caught this virus some other way? It's possible. We don't know yet. 5 confirmed cases in Portugal, and 20 suspected cases of monkeypox as of May 18th in Portugal. So seems like there are a lot of cases there too. And again, they were not able to confirm any travel to endemic areas or travel and contact with other monkeypox patients. Okay, so that's what we know so far about the current spread of monkeypox. Let's talk about the history of monkeypox. Monkeypox has been known to infect humans for thousands of years, or at least suspected to. So there have been cases of smallpox over the years, and we've essentially eradicated the disease. The benefit of eradicating smallpox with a vaccine, the vaccinia virus vaccine, was that it protected us from zoonotic pox viruses, such as monkeypox virus. So it did infer some immunity, but we have not been vaccinating humans for smallpox for many years now, mostly because we've essentially eradicated the virus. So as you have more population susceptible to the disease, there's more likely that we spread the disease. So do you go out and get the smallpox vaccine, the vaccinia virus vaccine? If you can get it, sure. The good thing about monkeypox in comparison to COVID-19 is we already have FDA approved medications as well as FDA approved vaccines that protect you from the virus as well as treat you once you have the virus. So let's talk about the different ways you have to protecting yourself. So of course, if you know somebody that may have contracted a disease with vesicles or pustules, pox-like disease, you do not want to have contact with that person, because while it may not be monkeypox, you don't know, it could be, and obviously they are ill with some disease, likely viral, because most vesicular diseases are viral, and you don't want contact with them. Belgium is the first country to enforce mandatory isolation for patients who have contracted the monkeypox virus. As the cases spread, I'm sure other countries will have to do the same thing. Monkeypox in humans is not necessarily known to be very deadly, but it is disfiguring. You get a lot of these pustules, and as these pustules go away, they do leave scars behind, and most people would like to avoid getting the disease if possible. A lot of cases of monkeypox virus will go undiagnosed because for most people, they're essentially asymptomatic or may have febrile illnesses without the rash ever appearing. Even when the rash appears, it is similar to zoster or chickenpox. It could be appear similar to other pox viruses that are endemic but do not cause any severe illnesses. And so some practitioners like myself may assume that this is not monkeypox and not test for it, and now that person is spreading the virus. So there may be a lot more cases out there than we currently suspect. One distinguishing feature of the monkeypox virus is all of the pustules are of the same stage. So they all sort of appear at the same time. They're all at the same stage and then go away pretty much at the same time. Another thing is lymphadenopathy. So people who are not vaccinated against smallpox will get lymphadenopathy. So like swollen lymph nodes under your on your neck, under your jaw, or your armpits or your inguinal area. That is seen very frequently with patients with monkeypox. Okay, so let's say you get monkeypox. What are you to do? So essentially, just like any other virus, the treatment is supportive. So plenty of fluids, Tylenol, Motrin to treat the fevers, and medications for nausea if you have nausea. And if you need it, if you're unable to keep food down, going to the hospital to get IV hydration. Now, there are antivirals that are FDA approved for the smallpox, which can also presumably treat monkeypox. We don't know for sure, but there are. Now, I don't know how many doses of these antivirals are available. So if there is a massive outbreak, I don't know if there will be enough doses, but there are FDA approved treatments already. So massive scaling of those manufacturing those medications will likely be possible. And we know from COVID-19 that these companies put in a lot of effort into mass producing when absolutely necessary. There are two antivirals. The tecovirimat was approved in 2018 for the treatment of smallpox in the United States for non-humans, so primates. But presumably if the medication works in primates, it can work in human too. The second medication is brincidofovir, which is another antiviral that was FDA approved for treatment of smallpox, this one in humans, and we can, of course, mass scale and start using it in humans. It's an oral medication if needed for monkeypox. There is also cidofovir, which has not been approved yet, but has worked in the past in animals with the pox virus. So let's talk about mortality. So in Central Africa, the fatality rate for monkeypox is approximately 10%, very high, right? COVID-19, 1 to 2%, 10% in Central Africa, but Central Africa is not the United States, it's not the Europe. So, we have better supportive care, we have better other medications. We also have FDA approved medications for the treatment of smallpox that we can use. So the actual mortality will likely be much less. Death usually occurs in second week of illness. There are no deaths reported in the United States from monkeypox in the past, right? So that's probably because we have really good supportive care and we have other medications at our disposal if needed, which they were not needed in the last outbreak because everybody's disease resolved with supportive care. At that point, it was thought that it was a less virulent strain in 2003. Now there's more human-to-human transmission, so it's hard to say if it's the same virus or if it's a different virus or if it's more deadly or not. Thankfully, though, we have had no deaths so far, and our first case was May 7th, so we don't have a lot of data, but we have had no deaths whatsoever. That does not mean that they're not going to happen down the road, but at least it's looking positive so far. So the disease is spread by contact with bodily fluid containing the virus. So that's fluid from pustules that may have popped, that's respiratory droplets, that's saliva, that's sexual fluids, things like that. You want to protect yourself by not having contact with such fluids in a patient with suspected pox virus. But if it's a stranger, it's in general a good practice to not have contact with their bodily fluids anyways. So then you're protected, right? Now, if we have many thousands of cases of monkeypox, then perhaps people will start wearing their masks again to protect themselves and others from spreading of the virus, because a lot of people are asymptomatic. And I want to reiterate that most patients with monkeypox will have mild disease and recover without any medical intervention. So you don't necessarily have to go to a physician or a hospital unless you're having severe symptoms such as unable to keep any food down, feeling dehydrated, feeling like you're going to pass out. If your family members notices you're confused, these are the things that you want to go to the hospital for and seek care for. If you have mild disease, or if you have disease and you're in an immunocompromised state, it may be worth it for you to contact your primary care doctor and see if they think it's appropriate for you to take the antiviral that's been FDA approved for smallpox. There are no widely available tests for the monkeypox virus, so most physicians will not be able to just go ahead and order a test for you. That is coming down the road as the virus is spread. I'm sure most healthcare facilities will have some contract with the lab to send out these special tests, and it will become more widely known to your providers as far as what test to order and what the turnaround time will be. For prevention of transmission of the monkeypox virus, you should have both contact and airborne precautions. So when you're in a hospital and you have a generalized rash, you may be asked to put on a mask because it is spread airborne, and you might see that everybody coming to check your rash out may be masked up, gowned up to protect themselves as well, right? So these are just generalized precautions that everybody should be taking for any pustular rash, because smallpox is still around. But most of the times, healthcare providers are humans too. They don't think about these diseases and they might forget. But as monkeypox is getting more press and more people know about it, perhaps more people will be more careful. If you have had close contact with somebody with confirmed monkeypox or suspected monkeypox, you should be isolated. So isolation time, unfortunately, can be pretty long in monkeypox. Could be about 2 to 3 weeks, especially if you are known to have the disease. Incubation period, like I said, is 10 to 14 days. So even after exposure, you may have to isolate for a long time before you figure out if you've got the disease or not. So if you have close contact, keep your mask on when around other people and monitor for your symptoms. See if you're having fevers, chills, body aches, myalgias. Now, those symptoms could also be from COVID-19, influenza, or any other virus. But if you've had close contact, then it's more likely from that virus than any other virus. And so you should just keep an eye out for your symptomology and contact your primary care doctor if you do exhibit any of these symptoms, and see if they think it's necessary to test you. There are some post-exposure smallpox vaccines available. So what does that mean? So let's say you've been exposed to monkeypox, and do you now just wait for yourself to get the disease, or do you go ahead and get yourself a smallpox vaccine? So let's talk about post-exposure vaccination. Okay, so post-exposure vaccination with the MVA vaccine, which is the smallpox vaccine that we use now, can be considered for certain patients. So somebody with direct contact with the patient, or with materials that was used to treat the patient, right? This decision is made by our public health authorities. if you had prior vaccinia virus vaccine, then you are protected essentially. For those who had close contact but are immunocompromised, it may be worth it for them to get the immunoglobulins. So where you don't get the vaccine, but you get the antibody directly for the vaccinia virus. Now that that may or may not be available depending on where you are in the world. As of now, there have been more than 100 confirmed cases of monkeypox worldwide, and it has been confirmed in 12 countries, including the United States, Australia, Belgium, Canada, France, Germany, Italy, the Netherlands, Portugal, Spain, Sweden, and the United Kingdom. So as you can see, it's spread across many different continents around the world, so essentially it could be considered global now. I would presume that it also exists in Asia, China, India, things like that, but the healthcare system there are very disconjugate when compared to the Western side. So there may be cases that are unidentified, and there are less public health testing and viral tracing and things like that going on there. So there probably isn't this advanced testing to figure out if it's monkeypox or not. So the risk to the general population remains low at this point, given that there's only 100 cases or a little over 100 cases around the world. But that does not mean that it cannot snowball, as we've known from a recent pandemic with COVID-19. But monkeypox isn't necessarily spread the same way. It's not necessarily as virulent as COVID-19, and the mortality rate is really not the same as with COVID-19. So the concern overall is low, but it is still good to know about what this virus is, how to protect yourself from this, and how to protect your loved ones from this.